Remember, an INCRA is something that you can do that wasn't necessarily originally rooted in some therapy technique, but it's a relational activity that has the power to be therapeutic. So, for example, playing cards, playing basketball, listening to music. These are all things that, again, take the pressure off of the youth to actually talk or do something when the youth is triggered in a moment, and also have the potential to regulate the nervous system back into the window of tolerance. So when utilizing INCRAs for youth that are extremely triggered, there's a special role of the somatic INCRA. So remember, there's somatic and there's non-somatic or cognitive INCRAs. A somatic INCRA is anything that gets the internal nervous system going in any way. So going for a walk, exercising, playing basketball or football or some type of sport, listening to music. You might think that, how is that a somatic INCRA? Well, when somebody listens to music, oftentimes, not always of course, but especially with the youth that we work with, there's a lot of times when they start to bob their head back and forth and move their body to the rhythm and the beat of the music. And what that rhythmic movement does is it starts to regulate the internal nervous system back into the window of tolerance. Other somatic INCRAs include dancing, singing, and of course you could probably think of some others as well. What I want to invite you to do right now is pause this if you need to and think about the types of somatic INCRAs that you have available to you in your context right now. So as a therapist, you might be able to do all of this stuff on the list on the slide. Go for a walk, exercise, whatever, or take a kid to play some basketball. As a school teacher, you may not be able to do all of this. You may have the responsibility of teaching a math class or teaching a social studies class or something like that. So you might be more limited. So it's important to know what you can do. Maybe music is your thing, or maybe getting kids to get up and sing and dance is your thing. And of course, we talked about this before in the last lesson, but when you're a school teacher and you're doing group-based work, you may have to be creative in how you incorporate INCRAs, and that may be, like listening to music at the beginning of the class, or setting up a type of culture where kids sing and dance at certain parts, like if they break one of the agreements or something like that, or just to practice their presentation skills or something like that. When you set that culture, then you'll be able to utilize these types of INCRAs with the youth, and there'll be some leverage in the relationship because they'll already be used to doing them and it won't be completely out of the blue. But again, what the somatic INCRA does is it helps the nervous system, that activated hyperarousal or even hypoarousal, and we're going to go over some specific examples in a little bit, it helps them come back down into the window of tolerance. And one more time, the goal is not necessarily for the individual to feel extremely good or positive or, in a happy state, but just to get back into the window of tolerance, just to get back into that therapeutic window so that further intervention can be applied. A quick note, going back to the scenario, if you're a classroom teacher or just don't have the same types of freedom or abilities that a therapist might have in terms of time and INCRAs available to you, it's really important to know your limits, right? Like, if you are a teacher and you just don't have the ability to do something like this and a kid is extremely triggered, what the thing might be to do, or what the goal might be, is to refer that person to the school counselor, to the school psychologist, so that they can then intervene. And that's why it's really important to know your system wherever you're working, whether it's in a clinic or a school or whatever the institution is. If you're working in an institution, you should know who to call when for these types of situations, because even if you're a therapist, if you're not coming from a trauma-informed lens, if you're not trained at an expert level in trauma, then when somebody is really presenting with complex trauma, is extremely triggered, you want to know who to refer to so that they can get the help that they need and deserve.